Hey champions, I hope that you, your family members are safe, healthy, and you all are doing really well these days. And your studies are also going well these days, right? So, as requested by majority of the students to have detailed insights on various diseases like malaria, typhoid, AIDS, like rabies, so many other diseases you told to explain in detail. So here I am with the very first video of this series, and that will be on malaria. So malaria infects about 300 million people around this world, and it kills about 2 million people every year. So it is a fatal disease, isn't it so? Now the question is, sir, what is the causative agent? है ना? So the malaria is caused by a protozoa. Name of that protozoa is Plasmodium. Okay, remember this. Plasmodium is going to cause this malaria. Now question comes is, like, what is the mode of transmission, how it is transmitted from one person to other person. So here female anopheles mosquito plays a very important role. So bite of this female anopheles mosquito, which actually feeds on human blood in order to obtain proteins from the blood plasma, because that is required for the development of their eggs. So it actually spreads. Female Anopheles mosquito spreads the disease from an infected person to a healthy person. See, male Anopheles mosquito, they are not going to do this because they actually feeds on the plant juices. Okay. Now the question is, sir, what is the incubation period? So in this case, incubation period totally like differs from one Plasmodium species to other. Like there are different species of Plasmodium, like Plasmodium ovale, Plasmodium falciparum, Plasmodium malaria. So different kinds of Plasmodium species are there. And incubation period, like many of you were like seeming, what is this incubation period? So incubation period is actually the period from when like the causative agent entered into the body and the first symptom is visible in the body. So that period, entry se leke the first symptom, that complete period is incubation period. And for malaria disease, this incubation period varies depending on the species. Now, talking about the symptoms, what are the symptoms of malaria? So, the main and common symptom of malaria, which is seen in the individuals having malaria, that is headache. That person is having too much of headache, right? That person is actually having very high fever. That person is actually feeling pain in the muscles. Nausea like feeling is there, nausea is there, headache, muscular pain, high fever. All these are the common symptoms in the patient which are suffering from malaria. Now, do you know malarial attack is also there? Yes, my champions. So each malarial attack is 6 to 10 hours long, right? And it is completed in, each attack is completed in three stages. Stage one, that is called cold stage. When the patient in this stage is going to feel very cold and begins to shiver, right? The stage two is hot stage. When the patient feels very high fever, patient is suffering from very high fever, and the breathing rate is also increased. Even the heart rate is increased in this stage two. Talking about the stage three, this is called sweating stage. In this stage, patient shows profuse sweating entire the body, and also the body temperature like returns back to the normal after sweating. So these were the three stages in a malarial attack, right? Each malarial attack. Now the question is how we can treat, how the malaria disease is being treated. So there is a drug, as I told you in the class also, quinine. Quinine is actually a drug which is actually developed from the bark of chincuna tree, and that is used for the treatment of malaria. Apart from quinine, quinine is the most important one. Apart from quinine, other medications are also given to the patients. For example, mefloquine, yes, artemisinin, doxycycline. These are the other medicines which are prescribed for the treatment of malaria. Now the question is, sir, how we can prevent ourselves from malaria? What are the preventive measures? So see, to prevent the entry of mosquito is one of the important thing to understand. To prevent the entry of mosquito by using insect repellents, mosquito nets, right? See, mosquito larvae can be killed also by like sprinkling kerosene oil whenever there is water, stagnant water bodies nearby our home. So we can just sprinkle kerosene oil. Apart from that, also if there is large water bodies, nearby our home, so we can introduce larvivorous fishes. So larvivorous fishes, for example, gambusia. Gambusia is a larvivorous fish. Minnows we can introduce, trouts we can introduce in the water bodies. They can easily eat the larvae of the mosquito. So breeding grounds of mosquito should be destroyed also if is there around like our home. So I hope you all understood about the malaria disease. So there is a question for all of you, right? And the question is, the anti-malarial drug is obtained from. Options are option A, roots of cinchona tree. Option B, bark of cinchona tree. Option C, leaf of cinchona tree. And option D, any part of the plant. So please do answer your response in the comment section, and we will be again back in the next video with another disease. So take care everyone. Stay happy, stay blessed. Bye bye.